Ministers are studying proposals aimed at getting the economy restarted, including easing some measures of the lockdown. The Prime Minister will set out plans next week, with the Community Secretary today saying he appreciated the restrictive measures were difficult, he said, for everyone. He was speaking during today's Downing Street press conference, during which Robert Jenrick announced a package of measures to support those living with the threat of domestic violence, sexual abuse and modern slavery. Well, it comes as 621 more people died in the latest 24-hour period. That's those who've tested positive for coronavirus and died in hospitals, care homes and the community. The total number of UK deaths now stands at 28,131. Tonight, Boris Johnson has revealed details of how close he came to dying, telling The Sun on Sunday that doctors were making preparations to announce his death. We'll have more on that in a moment, but first here's Chris Mason's report on the day's events.
This is what relative liberation looks like right now, being able to throw junk into a skip. In Manchester this afternoon, the prospect of a trip to the reopened tip had people queuing to get in.
Just can't wait to get rid of the stuff before it piles up anymore.
With the green bin at this time of the year, everybody's on lockdown in the garden. It's just full of waste all the time. We need to start emptying them again as soon as possible.
At today's government news conference, the focus for the Community Secretary was offering new support for victims of domestic abuse in England.
Today I can announce a package of over £76 million in new funding to support the most vulnerable in society during the pandemic. This funding will help charities support survivors of domestic and sexual abuse.
The government's proudly talked up the huge expansion in its capacity to test, but the next colossal challenge as restrictions are eased is tracking and tracing new outbreaks so they are contained, including via an app for us to use. I wonder where we are in terms of an update in the staff that are being trained and the extent to which that system needs to be fully up and running before we'll see any noticeable shift in an ease of the restrictions around lockdown.
There are some very experienced people already in public health teams in local authorities, for example, working under directors of public health and in Public Health England as well. But clearly to get this up and running at scale and effectively is another significant task, but lots of preparation underway.
The medical, economic and societal challenges posed by this virus remain vast. One positive, though, has been delivered very, very quickly: the near eradication of rough sleeping. Ministers now want to ensure as few people as possible return to a life on the streets after lockdown.
Well, Chris joins us now, as you can see, and let's return to that issue then of Boris Johnson giving his first interview since leaving hospital. Yeah, this is an interview in the Sun on Sunday tomorrow, in which, as you were saying, he says that doctors were prepared to announce his death. That's how serious his condition was. He tells the paper he was given litres and litres of oxygen. And then he says, it was a tough old moment, I won't deny it. They had a strategy to deal with a death of Stalin type scenario. I was not in particularly brilliant shape and I was aware there were contingency plans in place. The doctors had all sorts of arrangements for what to do if things went badly wrong. They gave me a face mask, so I did get litres and litres of oxygen. But as if to prove that Boris Johnson's life only ever happens in primary colours, take a look at this, a picture of Boris Johnson's new baby son, put on Instagram by Carrie, his fiancée, Wilfred Laurie Nicholas Johnson. Wilfred after Boris Johnson's grandfather, Laurie after one of Carrie Simon's grandparents, and Nicholas a tribute to two of the doctors, Dr Nick Price and Dr Nick Hart, who, in the words of Carrie, saved Boris's life. I'm no paediatric expert, but looking at that photo, there's a Johnsonian head of hair. Grace, thank you so much. Thank you. Now, thousands of people have registered to take part in a trial that uses blood, specifically blood plasma, from people who've recovered from coronavirus to treat then sick patients. It's one of the latest trials in progress aimed at helping the worst affected people to fight the virus. Our health correspondent Catherine Burns has more.
Could this golden liquid be an effective treatment against coronavirus? It's not an expensive new drug, but blood plasma, freely given by survivors. Jo's not a regular donor, but she's doing it slightly squeamishly because her whole family got coronavirus. Her husband was ill enough to need hospital treatment.
I'm somebody that would not have donated purely because I'm quite terrified of needles and giving blood. But everybody needs to do their bits, and you know, we're all getting touched by this virus in one way or another, and if this is something that's going to help, then I would urge people to seriously think about doing it. It's not that bad.
The idea is simple. Donors need to have had coronavirus and fully recovered. Then the liquid part of their blood, plasma, contains antibodies produced by their immune system to recognise and fight the virus. Researchers say when this is given to critically ill patients, it gives them some instantaneous immunity. More than 6,500 people have already gone online to volunteer. They need to have either had a positive coronavirus test or, like me, to have self-isolated with symptoms. People can't just turn up to their blood donor centres asking to give plasma. They need to make an appointment at least a month after being ill. The first priority will be confirmed cases, and researchers will be ringing these people asking if they'd like to be involved. So far, about 150 people in England have donated plasma, each one hopefully giving enough to treat another person. Every donation is checked to make sure there's a high enough level of antibodies.
We're ready to go and speak to the consultant to try and get consent.
Now the intensive care consultant running the trial is looking for patients to give that plasma to. So far, he's still waiting because he's not seeing as many seriously ill people with coronavirus now.
It's a good thing that the pandemic, there's a semblance of control of the pandemic here. So I'm actually both happy and feel that we are ready if second wave happens. This will help us immensely in the future because we can store this plasma, freeze this plasma, thaw it and use it in patients if there is a second wave in the future.
The hope is that if this trial works, we will have an effective treatment against coronavirus. Catherine Burns, BBC News.